watching a special edition of Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein, and thanks for joining us. On today's show, we examine the worlds of cosmetic and restorative dentistry. What is new? Has the technology changed? And how do you know which choice is best for you? So sit back, relax, and get comfortable. We'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. We're excited to have in studio today one of Nevada's finest cosmetic and restorative dentists, Dr. Marco Padilla. Dr. Padilla is an internationally recognized authority on the art of dental restoration and cosmetic procedures. Dr. Padilla has taught this art form all over the world, as well as having been on staff at the University of Pittsburgh and Ohio State here at home. I've invited Dr. Padilla on the show today to share some of his vast knowledge with us. Dr. Padilla, welcome to the show.
Thank you, Mike. It's a great pleasure to be here this morning, and I'm ready for any question that you may have.
Well, I'm going to ask you all about restorative and cosmetic dentistry, but before we get into that, tell me a little bit about your background and your practice philosophy.
Yes, my background, I was born and raised in Costa Rica, where I got my DDS. Then I moved to Ohio State University. After practicing 8 years in Costa Rica, I went to Ohio State University to pursue specialty training in prosthodontics. I did a program there for 3 years, where I got my certificate in prosthodontics, and at the same time I got my master's degree back in 1987.
Okay, I just want to talk to you about that for a little bit, because I was very impressed when I learned that you were a general dentist for 8 years in Costa Rica, got the same, and you told me that most of your teachers there had been trained here in the States, so
Absolutely.
that basically the dentistry is the same. But you came here not speaking any English. You went to school at the University of Ohio, or Ohio State, and you went to school at Pittsburgh, taught yourself English while you were going, and got your prosthodontic degree all at the same time.
Yeah, it was one of the hardest periods of my life, because being in such an institution, in a specialty training, and speaking, not speaking the language, not understanding everything that was said or couldn't express myself, was perhaps one of the hardest moments that I ever experienced.
I don't think many people at the age of 33 would attempt that. And that would take a very special dedication. Do you think that what drove you to do that also helps you in your attention to detail in your practice?
Yes, it did. I overcame the problem as much as I could, simply because I had a goal in mind, and the goal that I had was to excel in dentistry. So because of that, I spent hours and hours and hours learning the language along with prosthodontics. And then after that, all that effort that I put learning the language, I also transmitted that to my practice, so I can practice with the same amount of excellence that I always thought or always wanted.
Okay, now, first of all, what exactly is a prosthodontist? I mean, there's periodontists, there's prosthodontists, there's endodontists. What does a prosthodontist do?
Yeah, a prosthodontist is a dentist who has 2 or more years of specialty training in the complicated fields of restorative dentistry, cosmetic dentistry, implant dentistry, denture fabrication, removable partial dentures, TMJ problems.
All right, Doc, I know that you do this every day, and I know you get referrals from general dentists, periodontists, oral surgeons, even your own patients. But why would an oral surgeon or a periodontist or a general dentist, why would they refer you someone?
They do it, Mike, because they want the best for the patients. I do not do surgery, I don't do periodontics, I don't do orthodontics. So these colleagues, they know that I specialize on restoring difficult cases. And they are all difficult cases, and that's why they are referred to us. At the same time, when these patients come to us, I try to keep everybody involved with their cases, with their patients. So basically what I do is I try to make my office an extension of their offices. And every patient that comes to my office, I go back to the referring dentist and give them information about the planning, give them information about what I want to
Do you think that that's very important in getting the proper or the best outcome in a case?
I think it is very, very important to get the referring dentist involved in this particular case because normally when we are done, I refer these patients back to them for a follow-up, and between the two of us, keep maintaining these patients for a long time.
Okay. I know you've brought a lot of pictures, and I really want to get into them because it wasn't until I started to look at your pictures that I truly understood what you meant when you said the best. So let's go to the first picture. And this is a pretty simple picture to me when I first looked at it. This is a case where a lady already had dentures, and you made new ones. And I was thinking, why would you do that? Because she already had a set that fit. And now I look at the picture, and we see her in the before picture. That's a denture. And she has, it looks like a piece of plastic coming down between her teeth.
It is true. The before picture shows a denture that was not very cosmetic, and she was very, very unhappy with this, with her smile especially. The after picture shows the denture when we finished, and she came over for some follow-up. As you can see, the smile totally different. You can see some makeup, and it was nice to see that after we finished with this denture, she started changing the way that she was using makeup, the way that she was dressing. And what was nice about this particular patient is 3 years later, I saw her again for another follow-up, and she told me that because of her new smile, she started socializing more. She found a boyfriend, and then she got married.
But why would she buy or pay for a set of dentures that look like the one in the first picture? I mean, do you see that every day?
Why they do something like this, I don't know. Patient asked me that question, why was not done properly to start with. I cannot answer that question because we all know what a nice denture is.
And I know, I promised I wouldn't put you on the spot about this, but it's a big issue to me because I know, do you think, is it possible, because I see advertised dentures in a day, dentures overnight, mail-in dentures. Do you think sometimes that the quality or the aesthetic look is compromised in that kind of situation?
With denture, we have nothing to work with. We have to start from zero. There is nothing in the patient's mouth, and we have to build on from that point to give these patients stability, retention, support to the dentures, and also we need to give them function and cosmetics. And having nothing to work with and go to results like this is a very, very challenging situation that cannot be done overnight.
We got to take a quick break, but before we do, I want to point out one more thing about this picture. You made the comment to me that naturally when you smile, your front teeth are supposed to come down and just barely touch your lower lip. And in this case, the denture was made so bad that the lip actually comes up over the teeth, which gives it that kind of smelled something bad look.
It is true. It's very anesthetic when the lower lip overlaps the upper front teeth. That doesn't give the patient a good cosmetic result. And on the after picture, you can see the position of the incisor or the border of the teeth just missed the lower lip, and that gives them a totally different cosmetic
We've got to
result.
take a quick break. When we come back, I'm going to get right into the rest of your pictures. We're going to talk about crowns, bridges, single teeth implants, multiple teeth. We're going to go through the whole thing. You're watching Medical News Network. I'm Mike Wiggenstein. We'll be right back.
Whether you're expecting or looking for that perfect baby shower gift, we have you covered, baby, at PregnancyStore.com. Predict ovulation up to 7 days in advance with 98% accuracy with the OvaQ Fertility Monitor. It measures saliva electrolytes and is reusable. See and hear your baby from anywhere in your home with Baby's Quiet Sounds Color Video Monitor. PregnancyStore.com. It's the one-stop shop for moms-to-be.
Welcome back. We're in studio with Dr. Marco Padilla talking about the artistic forms of cosmetic and restorative dentistry. All right, Doc, before we went to break, we were talking a little bit about dentures. Now let's get into a little bit about implants and veneers. Let's take a look at the first case here. You told me this is a multidiscipline restoration. I see she's missing a tooth on the front, the upper left-hand picture. She's missing a tooth, and the one to the left of it's got a little bit of discoloration. So what did you do for this patient?
This was an interesting situation because that missing tooth or that tooth that is broken there had to be extracted. So what we did was we replaced that tooth with an implant and a crown on that implant. But at the same time, because she has some cosmetic issues on the adjacent teeth.
Well, the one to the right we can see in the first picture has kind of got a chunk
That's
broken out of
correct.
it, and the one on the left's got a little discoloration
So
on it.
we went ahead and with crowns and veneers, we restore those front teeth. And as you can see at the bottom, this is the final result that we have for her.
Okay, when I look at the bottom, now the front two teeth are both crowns.
The upper crowns, one of them is on an implant, and the other one is just a regular crown.
And then to the left of that is veneers. And I want to ask
yeah.
you about this because I talked to you about it. We know that there are a lot of, and I won't mention names because you asked me not to, but we know there are a lot of places that teach dentists how to do veneers. And I said to you, yeah, but they all look the same. I said, what makes a good-looking, veneer job? And you talked about the artistic ability to create a natural-looking tooth. And if we look at this lady's teeth, we notice that just like a regular tooth, they're shiny, they got dents, they got bridges, they got ripples. They're a little bit more translucent at the bottom than the top. I mean, how much of the final outcome of the procedure, how much of it is actually artistic and how much is technical skill?
Yeah, to me, there's more artistic than technical. Anyone can make a tooth, but to make a tooth that really looks like a tooth, it requires a lot of artistic skills and also knowledge of the normal anatomy of every particular tooth, knowledge of the materials that are being used to fabricate a crown or veneer or whatever it is.
So are you telling me that a veneer might be different for everybody based on their jaw or their mouth or the size of their teeth?
Yes, it is. Every tooth in everybody has different texture, has different contours, different translucency. So every person is different.
Now, do you think that there are a lot of dentists out there that have the, and I hate to call it this, but the quote-unquote one-size-fits-all mentality when you go in to get work done?
There are many outstanding dentists out there. However, it is critical to have a good laboratory that gives us or gives them really, really natural-looking restorations, no matter what it is.
You brought up the lab, and I know, and I talked to you recently, that you actually take your lab tech, even though they're in a different part of the country, you actually take them with you to different lab seminars so that you learn together how to do a better-looking restoration.
Yes. What happens, Mike, is when I was having my training in prosthodontics at Ohio State University, part of my training was to do all the lab work. So I used to do all this myself. However, I was living in the office 24 hours a day, 7 days a week, and because of that, I had to get the help of a lab technician. And because I know all this, how to do it, what it is, so I picked one lab technician, and I have been training him for many years.
So they know exactly what you want and exactly how you want it.
I want him to be up to my standards.
Okay.
And in order to do that, not only I have to teach him or them, but also constantly I take them to courses to be abreast of the new technologies.
Do you think you get better lab results because the lab knows you know what they're doing?
Absolutely. They spend more time doing the work for me. Otherwise, they know that they're going to get it back, or I don't even receive it.
All right, let's go to the next picture. Okay, kind of take me through. The first picture is how they showed up in the office.
The first picture on the left, this is how the lady came, and that's pretty much her smile. And the picture on the right, top right, you can see that black tooth around the gum line.
What causes that?
That was a tooth that she had a trauma over there. The root was getting really, really bad, so had to be taken out. Down below, you can see a temporary tooth that was placed there, but also because of the inadequate distribution of space, we had to treat the case with orthodontics to move teeth around to create enough space to give this person the right proportion for the two central teeth, for the lateral teeth, for the canine teeth.
In this case, obviously, you're using multiple disciplines to make this happen. Is that something that basically you probably have to offer that a general dentist or somebody that doesn't practice this all the time would?
Yeah, this is something that I do. I have a group of specialists that help me with these difficult cases. Oral surgeon was involved in this case, and also an orthodontist was involved in this particular case to give me the teeth in the position that I needed them to give the patient.
So are you telling me you're not one of those doctors that thinks, I'm the doctor, I can do it all?
No, I just specialize and I master prosthodontics, and I don't want to do any type of surgery.
And then you bring in the other ones.
So I bring people other specialties that can help me to do the
All right,
best
let's
for
go
the
to the
patient.
next picture.
This
All right.
is the same case. This is how she came, and at the bottom we can see how the case was finished. Took about 3 to 4 months from the beginning to the end to go from the before
That's a
picture
huge difference,
to the
so.
after. It's a huge difference, yes.
Now, some of those teeth are her natural teeth, and some of those teeth are...
The 6 front upper teeth are not. That's a bridge that I made for her, and the rest of the teeth, they are her natural teeth.
Okay, let's go to the next photo. Now, this is a fixed bridge. This gentleman came in, I'm going to take it with teeth up in the top, which the teeth look fine, but they're a little crooked.
Yes. This is another difficult case that I did in the office. As you can see here, we had to extract all the upper teeth because there were
Just
some
real quick,
problems.
because on the first picture, it looks like he's had prior dental work done on the bottom.
That's correct. He had
Somebody did it and didn't fix it the right way.
That's exactly right. You can see that lower teeth, they look like a roller coaster. It goes up and down, and something like that, but evidently cannot be, it's not aesthetic. So, but on the top, we had to extract all the teeth because there were many, many problems to make them unrestorable. So we took all the teeth out, and then implants were placed.
Okay, now the picture on the right is after the implants have been placed, and those are the healing caps.
That's correct, healing abutments. And then the picture down below to the left are the abutments that are going to receive the bridge. And on the right is an occlusal view of the bridge in the mouth.
Just meaning looking down on it from above. Okay.
That's correct.
Okay, let's go to the next picture real quick.
And here is pretty much the case. You can see the before picture, how the patient came, and here on the left is the after.
And I
after
would
was
have to
done.
assume that, A, not only is he going to smile more because he's not embarrassed by those teeth, but function-wise, he's got to be able to chew better, he's got to be able to speak better, and his self-esteem's got to have gone.
Absolutely. This case was finalized about 3 years ago, and we see this patient every 4 months for cleaning and a follow-up on the case to make sure that everything is in place. And so far, after 3 years, he's doing just
All right,
fantastic.
we're going to take another quick break. When we come back, I want to look at more of your pictures. I want to talk a little bit about just exactly why the artistic value is so important in the cases. You're watching Medical News Network. I'm Mike Wittgenstein. We'll be right back.
Mr. and Mrs. Jones, Sally's having some behavioral problems.
I guess that reward system isn't working.
Well, the timeouts weren't either.
You know, parents do find that timeouts aren't...
See?
Well, you're just too lenient.
Well, you're too strict.
No, you are.
you are.
No, you are.
No, you are.
When adults don't have the answers, they can feel as frustrated as kids. ConnectForKids.org has thousands of resources for helping kids in your community. ConnectForKids.org, guidance for grown-ups.
Whether you're expecting or looking for that perfect baby shower gift, we have you covered, baby, at PregnancyStore.com. Relieve morning sickness by listening to Morning Well's unique blend of music, special frequencies, and pulses. The Serenity Star Body Pillow is many pillows in one. It supports you while you're pregnant and makes an amazing nursing pillow. It's the one-stop shop for moms-to-be.
Welcome back. We're in studio with Dr. Marco Padilla discussing the artistic talents needed to perform the proper cosmetic and restorative dental procedures. All right, Doc, let's just get right back into the pictures because they're incredible. This next picture is of a diastema. Now, that is the gap. We call them seed spitters. We call all kinds of. Very cute when they're 5 or 6 years old. I've got to think that as you get older, it becomes a bit of a challenge. So tell me what you did for this gentleman.
Yeah, cases like this, anyone can do this. You don't have to be specialist to do this. All that you need is a little bit of knowledge and contour of teeth and materials that you
No,
are
I think you
using for
downplay that because I've seen a few of these done that didn't look very
And
good.
this particular case, not only there is space between the two teeth, but also the right one is broken. So this gentleman was really uncomfortable with this. And at the bottom, you can see how it was fixed in a very, very conservative way with bonding. We did a minimum grinding of the teeth, and then with tooth color material, it was restored. And you can see how nice and cosmetic.
So
this
sometimes it
looks.
doesn't require a whole lot. You
No.
told me this gentleman was he's a performer?
Yeah, he's a performer, and he was always very uncomfortable with that diastema in the front. And finally, he decided to do it. And as you can see at the bottom, his
Well,
smile
I
looks
just
by
think if
far
you just
much
look at
better.
the difference it's amazing what you can tell from just the way people smile. All right, let's go to the next photo. Teeth whitening. Tell me a little bit about.
Teeth whitening is something that patients request now as a cosmetic situation to resolve the situation
Now this
more than anything else. But anyway, this particular case is more difficult because this tooth, the dark tooth, has a root canal, and somehow this tooth became really dark. And again, this is another performer that we saw here in Las
Okay,
Vegas.
now, but it's my understanding that normally, once you have a root canal and the tooth dies, becomes dark, whatever it does, that teeth whitening won't get rid of that darkness in the tooth.
No, this particular case was done from inside out. So what I had to do was I just opened up the tooth on the back where they did the root canal. The root canal has to be redone by another specialist in endodontics that works in our office, Dr. Fernandez. And once she redid the root canal, then we proceeded and started bleaching the tooth from inside out. And as you can see, without any restorative material, without any grinding on the tooth, we brought the tooth back to the normal color, and we gave this young lady a beautiful, beautiful smile.
Okay, with that in mind, had this young lady gone and got, you know, crest whitening strips or the gels they put on, her teeth would have got whiter, but it's my understanding that that stain would have pretty much stayed the same.
Actually, when she was referred to the office, she was referred to have a veneer made on that tooth. However, when I look at the whole situation, making a veneer on one tooth like that is the most difficult thing to achieve a cosmetic result. So what I did was, as a first choice, was to do the internal bleaching. So to treat the tooth, from inside out.
But that's not something that a general dentist every day.
I don't know if they do it or not, but I took advantage of having an endodontist in the office, as I said, Dr. Fernandez, and with her help, and between the two of us, gave this young lady a beautiful cosmetic
She has a
result.
beautiful smile, and the most important thing is nothing in her mouth right now isn't her own.
Exactly.
There's
Everything
nothing
is
in it.
there. We did
All
not
right,
touch
let's
her
go to the
teeth at
next
all.
photo. This is crowns.
Yes, this particular case had to be done with crowns because there were some issues there with the bite and so forth. She did not like the position of
Now,
the teeth.
you just made a thing, and I don't want to stop you, but you talked about the position of the bite. Are you telling me that with crowns, with veneers, with any kind of work, you can actually change people's bites, their speech pattern, their...
Absolutely.
Do you see people that get lisps or get other speech impediments or have trouble eating after they have this kind of work done?
Yes, if it's not done properly, the phonetics can be altered.
Do you
that's a very
ever have to end up repairing a case that's done wrong?
Yes, once in a while it happens. It happens more so with dentures. But in this particular case, as I said before, we could not resolve this case with veneers because of her bite. We had to go with crowns. There were some minor orthodontic situations to correct over there. So you can see on the upper left the before picture and the after picture, all the misalignments that she had, and the position of the teeth, the incisal border of the teeth was changed to a, let's say, normal
Well, yeah, you can see her teeth
position.
are all very even on the bottom, whereas on top
Yes.
they're kind of short in and out. All right, let's go on to the next one real quick. And this is just another case of veneers.
This is a case done with veneer. This is a very, very pretty young lady that never liked her smile. Just happened that she had one extra baby tooth on the upper right side. So the best way to correct her smile, I suggested, was to go with veneers. So you can see all these spaces, small abnormal size for the lateral teeth. All that was corrected with veneers.
How painful are veneers?
No pain at all, no pain whatsoever. That's something that is very, very carefully done, and it's something that patients really don't suffer
And
anything
how
because
how long do they take?
the grinding that we do, the tooth reduction that we do is minimum. So patients usually don't have any pain with
And
this.
it takes a couple visits?
It takes a couple of visits.
All right,
I
let's
was-
move to your next picture because we are definitely out of time, but I want to get in
All
all
right.
of them I can. Your work is pretty amazing.
This is another case done with veneers. Beautiful, beautiful lady in the mid-50s that she wanted her smile to be changed. So the most conservative way to do it was with veneers. And as you can see here, the result is just fantastic.
And again, you can see the differences in the smile.
Yes.
All right, let's look at the next one.
What happened is every time that people lose teeth, the face totally sunk in because of the lack of support of the muscle of the face. So in this particular case, this lady had dentures, but were not properly made to restore her to the normal tooth position, to provide adequate lip support and cheek support. So we decided to go with implants, and what you can see here down below is a bar that we fabricated on the implants.
On 4 implants.
On 4 implants, and then a denture was made.
And it locks onto the bar.
Absolutely.
It's not coming out. She doesn't need poly grip. She doesn't need
nothing. It's incredibly comfortable for her, and the result, the functional result is just outstanding.
And it restores her face to...
Totally.
And then the implants in the bone will keep that bone from resorbing.
Absolutely.
All right, last
That's
picture,
one of
and then we're totally out of time.
And this is another case done on implants. This is a lower arch. You can see this person lost all the front teeth on the lower arch. So 4 implants were placed, and a bridge was fabricated there.
And now it's locked in.
Very natural. This is fixed.
It won't come
this
out.
Is cemented,
it doesn't
come out.
He doesn't have to worry about talking,
Nothing.
speaking, implant. All right, Doc, we are completely out of time. But before we go, and I have a couple other questions, I'll put you on the spot, but before we go, one thing, if there was one thing somebody watching the show at home today could take away about dentistry, one thing they could remember from the show, what would you want it to be?
Well, I recommend any patient to be careful where they go. I think dentistry has changed a lot during the last 15 or 20 years, and even during the last 5 years. So what was good 5 years now is maybe not that good, and we have new technology, we have new materials. So when something is going to be done, or somebody wants to get involved in this type of dentistry, I recommend to find a person that is totally abreast in the newer materials, newer technologies,
and I will tell you, you made a comment to me before, and I'm going to bring it up again. You said to me that one of the most important things in any relationship with the dentist is just that, your relationship with the dentist. And that it's very important that you feel comfortable with them and that you have a good interpersonal relationship.
It is very, very important. To me, we have to have 100% trust in both directions. If there is no 100% trust in both directions, it's not going to work.
And I've seen you, I have to admit, I've been to your office, I've seen you interact with your patients, I've seen the laughter, I've seen the fun they have, and it's almost like they're showing up at their friend's house versus a dentist office. I go in the dentist office, kicking and screaming.
That's one other thing that we have in our office. We have a group of wonderful, wonderful staff over there that every time that the patient come in, they make them feel at home. It's not a dental office. It's a very friendly place.
All right, I'm going to put you on the spot right now. I know you have a lot of information on your website. I know there's a lot of information available. They learned a lot on the show today. But if somebody had some questions, they had some concerns, maybe they didn't know the answer to, can they call you? And if they do, will you talk to them?
Absolutely. They can call me at any time. If I cannot go to the phone, they will take the telephone number and we will call back. But also, yes, they can access our website, and there is a lot of information there about what we do on a daily basis.
All right, I want to thank you for coming on the show. You've been watching Medical News Network. I'm Mike Wittgenstein. For further information on this subject or any other, please visit our website at www.medicalnewsnetwork.info. Until next time, I wish you good health.